Welcome everyone. We're so pleased to have you here for the 3:15 session at our conference. The title of this session is The Law of Large Numbers, Persons in Data Ethics. I'm Kirk Doran from the Department of Economics at the University of Notre Dame, and I'm honored to be moderating. We have two fantastic speakers today. Professor Jarrett Zigon from the University of Virginia is the William and Linda Porterfield Chair in Biomedical Ethics and Professor of Anthropology at the University of Virginia. He received his PhD in anthropology from the City University of New York and his MA in liberal arts with a focus on moral and political philosophy from St. John's College. He has been a member of the Institute for Advanced Study at Princeton, a visiting scholar at Columbia University, and a research fellow at the Max Planck Institute for Social Anthropology. He is also the former director of the Health, Ethics, and Society program and the former founding director of the Center for Data Ethics and Justice, both at the University of Virginia. His latest book, How Is It Between Us? Relational Ethics and Care of the World, articulates relational ethics through consideration of some of today's most pressing ethical concerns. He is also the author of A War on People, Drug User Politics, and a New Ethics of Community, and Disappointment, Toward a Critical Hermeneutics of World Building, and Morality and Anthropological Perspective, among others. Ladies and gentlemen, Professor Zigon.
Thank you. So I just started coughing like 3 minutes ago, so perfect timing. Let's see how that goes. It's a real pleasure to be here, and I'm really glad to see everyone in the room. The talk I'm going to give today is a version of a chapter from a book of mine that just came out last week, and so I'm going to use 1 second to do a little self-promotion. And it's available now online for open access, free download. So I welcome anyone to go have a look if you find this interesting or repelling or however you react. Feel free to read it more in depth. The paperback will be available in December. So what is the person of data ethics? As data-centric technologies and artificial intelligence increasingly raise ethical concerns, this too often forgotten question ought to be our first. For the kind of person assumed within any conception of ethics goes a long way in determining how the latter will be articulated, implemented, and ultimately the consequences it will have for our social lives. I will explore this question today. It is for good reasons that many today call for the articulation of a data ethics. We are all familiar with concerns over such issues as data privacy or data-driven surveillance or the increased intertwining of the data industry with the finance industry or the so-called defense industry. We are all familiar with the fact that data extracting and data-driven algorithms increasingly regulate the temporal, affective, and intersubjective modalities of everyday life. And we are all familiar with the sometimes over-the-top, but sometimes legitimate concerns of how artificial intelligence may change the very definition of the human, as well as life itself. Indeed, all of this makes the increasing dominance of data-centric technologies in our everyday lives both an ethical and existential concern. There are good reasons, then, for why we are experiencing what I would call an ethical demand made by the data-centric situation in which we now find ourselves. What is too often missing from this demand, however, is the very question of the ethics, and thus the very question of personhood appropriate to data. This is so, perhaps, because prior to the question of ethics and personhood, we have neglected to ask the even more fundamental question of what is data? For it is precisely our response to this more fundamental question that leads us to our ethical starting point. This is so because any ethics begins with ontological assumptions about what we can loosely call the subject, object, and processes of ethics. And the question of data is fundamentally an ontological question. Therefore, if we are to ask the question of data ethics, we must begin by asking the ontological question of data. This talk then unfolds as a query. First, I ask how data is conceived by what I call the data-centric industry and its practitioners, and sketch one version of the so-called ethical response to this conception of data, that is, the call for the right to data privacy. What I hope to show is that the so-called ethical response to privacy is not ethics, but rather economics masquerading as ethics. This is so in large part because of the ontological assumptions of the data-centric industry, assumptions which are too often shared by those who critique it. As a response to this, I ask how shifting the way in which we conceive of data might allow for an appropriate and actual ethical response. Invoking the Latin origin of data, datum, something given as gift, I draw from Jean-Luc Marianne's phenomenology of the given to sketch a relational ethics of the gift. Such a notion of relational ethics, I contend, is not only more appropriate to the givenness of data, but more importantly to the givenness of the human person as a relationally intertwined being, and therefore to the very idea of ethics as such. What is data? A recent introductory text to data science defines data as a piece of information, or as an abstraction or measurement from a real-world entity, such as a person, an object, or an event. This concise definition is revealing. It tells us much about the basic assumptions of the data-centric worldview. First, as pieces of information, data are facts about something or someone learned by various means of investigation. Second, these information facts, as I will call them, are not to be confused with those things or persons as they are in the real world, but are instead abstractions or measurements. As the authors of this text put it, data are generated through a process of abstraction, so any data are the result of human decisions and choices. For every abstraction, somebody will have made choices with regard to what to abstract from and what categories or measurements to use in the abstracted representation. The implication is that data are never an objective description of the world. They are instead always partial and biased. In other words, data as information facts are interpretations. Despite the recognition of this, it seems clear that the data-centric worldview elides this crucial aspect of what data is, and instead considers these information facts as representative of, or a mirror of, the real-world entities from which they were abstracted. Indeed, the very notion of real-world entities carries with it a strong sense that these entities exist objectively, out there, in the real world. And although we may not be capable of coming to know them in their objective realness, if our methods are good enough, then our representations will be as good as objective knowledge. As the authors go on to say, the data we use for data science are not a perfect representation of the real-world entities and processes we are trying to understand, but if we are careful in how we design and gather the data that we use, then the results of our analysis will provide useful insights into our real-world problems. Data may be interpretation, thinking seems to go, but with the proper design and methods, our interpretations can be legitimately considered to be objective facts in the real world, here glossed as useful insights. I suggest it is this key move from the considered to be that collapses the distinction between objectivity and interpretation that is too often forgotten in data-centric practices. Thus, I can make a claim from which I will continue my argument in the rest of this talk. For most data-centric corporations, institutions, and practitioners, or what I call the data-centric industry, data is considered as observable, extractable, categorizable, and indexable facts in the world. These objective facts are conceived as out there, sitting dormant, filled with potential, ready to release their hidden value once properly collected and instrumentalized. Indeed, the very terms used in the data-centric industry to describe its own processes are indicative of this conception of data. Like coal and oil, data is yet another raw material to be mined, extracted, rendered, and sold. For a long time in the so-called Western world and beyond, raw material and natural resources have been conceived as a part of nature, that over which humans claim power and right to dominate and manipulate toward their own ends. Data as raw material is conceived similarly, but with the caveat that it transcends the nature-culture dichotomy. As such, data is considered to be everywhere, from the atmosphere to traffic intersections to mortgage lending. Most disconcertingly, data as raw material is to be discovered in and extracted from our phones, our homes, cars, bodies, and affective lives. Among nearly everything else one can name that is a part of who we are and how we live our everyday lives. Put another way, human experience has become the primary raw material for the data-centric industries. We in our lives have become the data-centric industry little more than what a coal field is to the mining industry, a source to be mined. Just as the forest, mountains, and rivers have for a very long time been ontologically rendered as standing reserve and placed for little more than human use, today everything, and most especially human experience itself, has been ontologically rendered standing reserve and placed for the profit of a few. Recall that according to the data science introductory text I referenced above, not only do well-designed data practices result in insights to the real world, but useful insights. The contemporary ontological condition, then, may best be articulated in the following manner. To be is to be of useful value. Note that by useful value, I intend at one and the same time to gesture toward the use value of Marxian economics and to indicate the way data is always available for multiple potential uses. Useful, that is always already full of potential, but as of yet unknown uses. This extraction imperative is now central to what Shoshana Zuboff calls surveillance capitalism. This new form of capitalism Zuboff defines as the unilateral claim of human experience as free raw material for translation into behavioral data. Importantly, we are not the customers in this new paradigm of surveillance capitalism, but rather the products. Or perhaps better to say, we are both resource and product linked through a disciplinary recursive loop whereby our words, actions, and affective lives are mirrored back to us in a fabricated manner so as to nudge us to make a particular predetermined action. Thus, surveillance capitalism's modus operandi is to alter our behavior to act in ways that result in massive amounts of profit for those who know how to do so. What we see then is that the elision of the interpretive aspect of data renders data little more than information facts that are said to objectively represent the real world. This in turn leads to such data being utilized to feed back into, or perhaps better put, to project onto and alter these real-world entities for profit. To be even more precise, there is a double elision done by the data-centric industry in that not only does it forget its own interpretive processes, but in doing so it covers over the very hermeneutic nature of its primary raw material, that is human experience, rendering this experience as behavior. Consequently, this double elision turns the essential hermeneutic nature of human experience and personhood into the illusory objectivity of behavior, which far from being real, is merely a projection of the designs, methods, and practices of the data-centric industry. Increasingly, this situation is recognized as problematic, and calls for protective measures are being made. The right to data privacy is the growing consensus in response to the new ethical imperative to protect our data. Whether conceived and articulated in more traditional liberal terms of individual privacy or in post-liberal terms, as for example, dividual privacy, the assumption seems to be that only a defense of privacy can protect us and our data. It is important to note, however, that several assumptions are being made prior to the evocation of privacy as our best defense. And these prior assumptions are analogous to those made by data-centered corporations, institutions, and practitioners regarding the data itself. I suggest there are at least three assumptions that ground the so-called right to privacy that can be understood as analogous to those of the data-centric industry. These are: 1, data are information facts, which we already covered. 2, data is something one already holds in possession prior to its extraction. And 3, if we and the data we possess can be protected from extraction, then we can maintain possession of it for our own use, enjoyment, or profit. Now, given more time, I would consider each of these assumptions more closely, but for now, you have to trust me that if these three assumptions are accurate, then the right to privacy response to the extraction imperative of the data-centric industries is ultimately the wrong response to the problem I outlined above. For ethics properly conceived cannot result in the perpetuation of the status quo, even with a slightly better state of affairs, however that better state may be determined. Rather, ethics, as an ongoing process of living together well, must result in a shift of the very world that we inhabit together. In the rest of this talk, I will begin to outline what I conceive as a properly ethical response to the problem of data surveillance and extraction and the conception of personhood this entails. That's not for me, is it? No. Good. What is data? In Latin, data is the plural form of datum, which means something given, as well as a present or gift. How does thinking of data in these terms shift the way in which we consider ethics in relation to data? To begin with, we immediately discern a modification to the relationality of a data-centric situation. Whereas the paradigm outlined above begins from the extraction and capture of data as information facts, already there in toto in the world, my proposed modification entails data as that which is given, and given not as fact, but as gift. Whereas the paradigm of data as information facts to be extracted and captured leads to an ethical concern focused on protection and defense of this data, as if it were property over which one had dominion, data as given invokes an ethical demand on the receiver to respond. As such, we witness a shift from an ethics of property defense to a relational ethics of the gift. Who is the receiver in this new paradigm of data as the given? Indeed, who is the giver? The first and easy reply would be that the giver is me, you, and everyone else from whom data is extracted, and thus the receiver would be all those extractors. But this conflates the data as information fact paradigm with the one we are thinking through here. For we remain within the binary distinction between the one that gives that which is possessed and the one that receives and becomes the new possessor. This conflation returns us, perhaps a bit more sophisticatedly, but probably not, to where we began, that is, stuck in an ethics of property defense. To liberate our thought from this paradigm, it will be helpful to consider a bit more closely that which is given. For only in doing so can we leave behind both the very idea of data as information fact, as well as the so-called ethics that leaves us stuck in this binary thinking. Phenomenology, and particularly the work of Jean-Luc Marion, will be particularly insightful for thinking data as the given, and ultimately the relational ethics of the gift that it offers. Building on Heidegger's notion of a phenomenon that shows itself in itself, Marion argues that what shows itself first gives itself. That is, in contrast to a metaphysics of objectivity that assumes that phenomena are always already there in toto in the world to be discovered and used for some purpose, a metaphysics that grounds data-centric practices, I should note, phenomenology begins with phenomena that give themselves and do so always only in part or as hermeneutical aspects of themselves. This is true whether the phenomenon is a rock, a coffee cup, climate, traffic patterns, a disease, an emotion, a thought, a Facebook like, one's marriage status, or indeed even one's self. What data-centric practitioners call data, then, is what phenomenologists call phenomenon, but with the important caveat that the former cover over the aspectual and hermeneutic phenomenality of phenomena by considering them as totalized and objectified information facts. All phenomena, by definition, show themselves by giving themselves temporarily and partially. Every giving of a phenomenon is simultaneously a withdrawal of that very same phenomenon. By definition, then, the phenomenon can never be known, understood, extracted, analyzed, coded, or used in total. In other words, all phenomena exist in excess of what we can experience of them. Consequently, anything that we can claim to know about a phenomenon is a matter of a situated interpretation of that which gives itself in part. What is now commonly referred to as bias in data-centric practices and technologies is the result of ignoring the situated interpretive relationship we necessarily always have with all phenomena. Importantly, for Marion, phenomena give themselves without condition. That which gives itself as itself does so without the limitation or imposition of a prior rule, principle, horizon, or subject. It is only through a situated interpretive relationship that a phenomenon is brought under the order of meaning. Meaning never arises with that which gives itself, but only comes to be by means of how that which is already given is acknowledged and recognized. Therefore, it is easy to see that our contemporary condition says nothing about the phenomena themselves, other than that they pre-exist as standing reserve for our use. In contrast, phenomenology begins with the assumption that nothing can be said of phenomenality as such other than that it gives itself. What can eventually be said, however, is a matter of those situated interpretations through which phenomena manifest meaningfully. But when these interpretations are rendered as objective information facts by data practitioners, then this is akin to these very practitioners holding a mirror up to themselves and naming the reflected image truth. Does it make sense then to ask who are the giver and receiver if we understand phenomenality in this way? No, it doesn't. For there is no who of givenness. The givenness of phenomenality precedes all subjectivity and interpretation, and that which gives itself does so to a receiver. Consequently, we can say that the data that might otherwise be considered mine, for example, my gender or my mood, is given to me. It precedes that which can legitimately be called myself at any given moment. As a first response to the question of giver and receiver, then, it could be said that I am both receiver and giver, and that I both receive, for example, my gender and give it. Such a response, however, entails a logic of possessive causality and a difficult-to-shake assumption of agentive capacity, such that I come to possess that which I receive and then have the right to give it as I please. Here we are back again in an ethics of property defense, even if the binarism of a simple receiver-giver relation is broken. When we take seriously phenomenality as that which gives itself partially and temporarily prior to any subjectivity, however, it is clear that I can only ever be a receiver of that which is given. As such, ontologically, I must respond to the phenomenality of givenness. Ethically, I must attune to it, and politically, I must respond with justice. This onto-ethical political relationality maintains the openness of givenness in a mutuality of existence. I remain forever a receiver of the unfolding of givenness that affects me, and it's precisely this reception that becomes me in every moment. My ongoing onto-ethical political response to these affects is indicative of this status as receiver. Put another way, this is the relational nature of personhood. And thus only when responsivity, attunement, and justice break down does relationality come to an end. This is when the person is reduced to an object. This is precisely what data-centric practices do. They break down responsivity, attunement, and justice, thus rendering the objectification of human personhood. In doing so, the open receptivity that is personhood is shut down, closed off, and mined as a source for extractive accumulation. This is not a matter of data-centric practitioners becoming the receivers and we the givers. Rather, this is a matter of the former being exploitative takers and the rest of us rendered raw material. The givenness of phenomenality is shut down, the relationality of givenness is cut, the attuned justice of relational ethical politics is disfigured into an ethics of property defense, perhaps better understood as economics. Sorry. Perhaps most famously, the sociologist Marcel Mauss is considered to have articulated an ethics of the gift in terms of the demand of a return. Put simply, for Mauss, to receive a gift entails the demand of a return to the giver. That is, the gift entails an obligation to reciprocate. Mauss describes the demand of reciprocity in the following manner. This system presupposes the obligation to give, the obligation to receive, and the obligation to repay. What should be clear here is that Mauss is not so much describing the ethics of the gift as givenness, as he is a total system of economic exchange in terms of obligation. In other words, for Mauss, the gift loses its very status as an indication of the phenomenality of givenness and becomes in turn a material causal marker of systemic obligation. Thus, rather than an ethics emerging from the very givenness of the gift, as he's, I think, too often read, Mauss is articulating a system of economic exchange founded on the causal logic of sufficient reason. Mauss then is not describing an ethics, but an economics masquerading as ethics. A similar pretense of ethics is increasingly presented as our best defense against surveillance capitalism. Perhaps the most blatant example is a recent piece of legislation presented in the United States Senate in response to the extraction for profit modus operandi of the data-centric industry. The Dashboard Act, introduced in June 2019 by Senators Mark Warner and Josh Hawley, will require data harvesting companies, such as social media platforms, to tell consumers and financial regulators exactly what data they are collecting from consumers and how it is being leveraged by the platform for profit. The central focus of the Dashboard Act is the monetary value of the data collected. Thus, as it is summarized on Senator Warner's website, the Act will require commercial data operators to disclose types of data collected, as well as regularly provide their users with an assessment of the value of that data. Furthermore, it will require commercial data operators to file an annual report on the aggregate value of user data they've collected, as well as contracts with third parties involving data collection. Although the transparency required by the Dashboard Act is laudable, its focus on the value and monetary aspect of data is problematic. For similar to Mauss's economy of obligation, the Dashboard Act is an economic response masquerading as an ethical one. The assumption of the Act is that if the value of one's data is transparent and one has the ability to opt out of having one's data monetized, then this constitutes data ethics. But note, this is just another iteration of the ethics as property defense that I outlined above. Much like a homeowner receives a property valuation estimate each year from their city, so too under the Act, each person will receive a valuation of their personal data and have the choice to defend that data by protecting it from others using it for their economic gain. To the extent that this could be called an ethics at all, and I certainly would not call it that, it is an ethics of the fence, or wall, as it does little more than create the illusion that it is possible to isolate oneself by cutting off relationality. Thus, just as Mauss's economics of the gift tells us nothing of the ethics of the gift as the given, so too the Dashboard Act and the similar data ethics and policy initiatives elide the givenness of the data and relational ethics it entails. We have come to see that data are the multifarious manifestations of the givenness of phenomenality. Having done so, we must finally address the question that has guided us through this talk. When we think data as the given, that is, when we preserve the phenomenality of the given, what are the proper conceptions of personhood and ethics that accompany this thinking? Recall that data as the given is not an object already standing there in the world waiting to be taken by the first human to come along with the means to grasp it. Rather, data as the given gives itself as a gift. Consequently, there is a certain kind of privilege bestowed upon the receiver. Put another way, to receive the gift of phenomenality indicates the privilege of being the kind of being that exists as an open receiver of the world. Such a privilege entails an ethical demand. And yet we must be careful not to respond to this demand with an ethics that is little more than economics well disguised. For the person in the ethics adequate to givenness maintains and attunes to ever-unfolding relations without the obligation of reciprocity. For Jean-Luc Marion, it could not be otherwise if we are to take seriously the non-economic nature of ethics. And yet, a relational ethics does entail a transitive response, such that that which is received is not possessed, but passed on. The philosopher Lisa Gunther has articulated such an ethics as followed. This gift does not belong to me, but rather commands me to give to others. And yet, if that which is given cannot be reciprocally returned for risk of reducing ethics to an economics, then to whom or what could the given gift be passed? In other words, to whom or what could the receiver become the giver such that the new receiver does not, reciprocate, but becomes yet another giver to whom or whatever arrives next. For Marian, one possible response is the community. To give to the community is to give to an existent that cannot reciprocate the gift, thus maintaining the ethical nature of relationality. This is so because the community as receiver is an absent receiver, and is so for at least two reasons. First, when the community is receiver, no individual can be set up as universal receiver such that she could stand in for the community, to accept on behalf of, or to say thank you. Second, the community as receiver is absent because it can only accept the gift for the sake of transmitting it toward receivers still to come. The community as receiver, then, can never be made manifest in the person of any one individual or group of individuals, but a community is an open being with in common that transmits the gift to those who will one day arrive. In this way, Marian tells us the gift achieves its perfect figure. It is a given without distinguishing among persons, in complete indifference to the worthiness or unworthiness of the givee, and complete ignorance of any possible reciprocity. Such an ethics of the gift resonates well with recent attempts within continental philosophy to rethink the notion of community in terms of openness and givenness. Perhaps the most significant contributor to this literature, and the one with which this ethics resonates the most, is that of Roberto Esposito. For Esposito, community is characterized by a mutual obligation to care. Thus, Esposito articulates a theory grounded on the open vulnerability of finite human existence and the community such existence demands. Esposito describes this notion of community by considering the etymological constitution of communitas in terms of the cum of being with and the munus of the obligatory care that such being with entails. The transitivity of the ethical relationality I'm trying to articulate then gives in such a way that it creates an openness for what or whoever comes next. This is what Marian calls tradition, which he describes as a forever future givee. Perhaps, however, it would be better to call it generationality, as the philosopher Anno Byrne might. For as the never fully present receiver of the gift, the community as an open being with in common only ever receives the gift so to transmit it to its not yet indifferentiable future manifestation. Put another way, the community receives the gift only to pass it on to the community to come, a gift to the not yet, perhaps best described as the gift of hospitality. And I just have a few closing words. I'll be done in a moment, I promise. I've tried to articulate a relational ethics founded on a relational conception of personhood that is adequate to our contemporary data-centric condition. In doing so, it was necessary to break out of the economics and thus debt of reciprocity, so to transcend the binarism of giver and receiver in the recognition that a relational ethics demands that those or that which receive in the future remain unknown. For neither ethics nor justice are a matter of following a rule, principle, or criterion, but rather a matter of attuning to situations and others as they arrive. How we respond can never be known prior to the demand of the moment. Similarly, we may know that our data as gift will be received in some form or another by those yet to arrive, but we hold no rights over how our data as gift will appear or how it will be received. Only as such can the relational ethics of the gift refuse the form of a transaction and instead be an offer of justice with all due respect to the ever-unfolding future of relational personhood. Thank you.
Thank you very much, Professor Zigon. We're going to hold questions to the end. We'll have one 15-minute period for questions. So now let me introduce our second speaker. Professor Paul Scherz is an associate professor of religious studies at the University of Virginia, where he focuses on the intersection of religious ethics, science, technology, and medicine. His first book, Science and Christian Ethics, used Stoic virtue theory as a lens to examine the moral formation of scientists in light of the contemporary reproducibility crisis, an ongoing methodological crisis in which the results of many scientific studies are difficult or impossible to reproduce, except in economics. His most recent book, Tomorrow's Troubles, Risk, Anxiety, and Prudence in an Age of Algorithmic Governance, examines the role that quantitative risk analysis plays in contemporary life. He has published articles on many topics in bioethics, such as human enhancement, genetic technology, and end-of-life ethics, with this latter interest leading to a co-edited volume, The Evening of Life, The Challenges of Aging and Dying Well. He is currently working on projects on the ethics of artificial intelligence and a book on the ethics of precision medicine. He teaches classes on bioethics, technology ethics, and Christian ethics, including religion, ethics, and healthcare, and death and dying in the Christian tradition. Professor Scherz holds a PhD and Master of Theology in Moral Theology from the University of Notre Dame, a PhD in genetics from Harvard University, and a BA in molecular and cell biology from UC Berkeley. Scherz has taught at the Catholic University of America. He was a Helen Hay Whitney postdoctoral fellow at UCSF, and he is a fellow at the Institute for Advanced Studies in Culture at UVA. Professor Scherz.
Thank you for that introduction, and thank you all for being here today. As Dr. Zigon discussed, we're seeing an ever-increasing focus on data in society and economics. Public intellectual Yuval Harari even prophesies a coming religion of data, dataism, in which we cease to value or even see individual persons, except insofar as they contribute to data flows. While such grandiose proclamations seem far-fetched, they do reflect the way that contemporary self-understanding increasingly is tied to quantitative metrics, key performance indicators in business, test scores in education, BMI, or likes on social media posts. Even when we try to limit our use of technology, we do so by tracking our screen time. The culmination of this trend is seen in the quantified self movement, whose members seek self-knowledge through quantification. Personal tracking devices like Fitbits allow individuals to monitor huge amounts of health data: pulse, blood pressure, sleep rhythms, calories burned, numbers of steps taken, and so forth. Quantified self-enthusiasts fear that felt personal experience and phenomenological analysis is illusory. Truth can only come through the objectification and mathematical analysis of aspects of the self, especially the body. Their motto is, "Know thyself through your numbers." My talk today examines the effect of knowing ourselves through data. Rather than the quantified self movement, I take up similar projects, I think, in population health and precision medicine as an example of how this self-image can contrast with Christian ways of understanding the person. Medicine has long been accused of reducing the patient to the mechanics of the body, but it too has shifted its focus to data. The physical body itself is disappearing into metrics: A1C levels, blood pressure, or cholesterol. Health is becoming defined not in terms of subjective feelings of wellness, but rather in terms of how well one's metrics are doing. New health conditions like prediabetes or prehypertension describe quasi-disease states that exist primarily in terms of metrics. Seeing these trends, thought leaders in healthcare began to predict a future of what they called personalized medicine around 15 years ago. It would be healthcare addressed to the needs of the individual patient as conceptualized through the integration of all these data. DNA sequence and the Genome Project was essential to this project. Health history, blood tests, diet, sleep habits, and more. As Francis Collins, former head of the NIH, described, all of this information, quote, will allow a considerably more useful estimate of your future risks of illness than is currently possible, enabling a personalized plan of preventive medicine to be established. All of the data would predict health risk, which can then be controlled. It is at this point that a problem appears in the quest to know the individual person through numbers. Risk and probability are, according to one prominent understanding of statistics, properties of populations, not individuals, groupings, collectives. Given 1 million drivers or 1 million 50-year-old men, insurance companies know how many accidents or deaths there will be. However, it is uncertain whether any particular individual will suffer one. As the economist Frank Knight noted, though we can determine risks for a population or large number of events, any singular decision remains uncertain. So similarly, many risk-based treatments only have effects when considered at the population level. 286 healthy patients have to be treated with statins to prevent one death, for example. New genetic technologies like polygenic risk scores only provide probabilistic estimates of whether a patient or an IVF embryo will have a certain trait. Precision medicine is a medicine based on probabilistic population-level effects. Its treatments and screenings may not benefit any one individual. So this is exactly why the field had to eventually change its name from personalized medicine to precision medicine, because of the realization that metrics tell us relatively little about the individual person. Instead, they help to place individuals in relation to populations, to groups. With a shared focus on data, population, and prevention, there's a great deal of overlap between precision medicine and what's called population health. Two concepts that might seem opposed, but population health similarly attempts to manage risks through preventive efforts as well as social changes. Recognizing this overlap, the field is undergoing another name change as institutions are bringing them together in endeavors like UCSF's Precision Population Health Program, or UVA's research program targeting precision medicine for populations. Knowing ourselves through data means knowing ourselves as a member of a population. My talk today reflects on this connection between the person and data, or rather on the paradoxical way in which the individual person is disappearing into population-level data, and the profound implication of this shift for medical ethics. Population concepts do not stay sequestered in medical charts. They feed back into our self-conceptions, practical reasoning, and even individual interactions in ways that reflect changed interpretations of moral concepts. And these concepts, such as solidarity and charity or care, many people are now advocating shifting our understanding of them to population-based understandings. Take, for example, an article entitled, "When Populations Become the Patient," published in the Catholic Health Association's Health Progress magazine, in which a health policy analyst re-narrates the corporal works of mercy in light of population priorities. Quote, "For I was hungry, and you ensured I did not live in a food desert. I was thirsty, and you guaranteed my tap water was safe to drink. Naked, and your donation did not shame me. Ill, and you ensured I had affordable health insurance. In prison, and the system rehabilitated me." Go a little further along this line of precision medicine, and you might get, "For I was ill with moderately elevated cholesterol, and you gave me statins." The author admits that his version is not as inspiring as the original and that he finds little support for population health in Christian scriptures. But he argues that is necessary given our state of knowledge and especially current institutional pressures to reinterpret the corporal works of mercy and more generally Christian charitable endeavors in terms of interventions on a population. My concern is not with the value of the structural solutions he suggests, which in many cases, in most cases, are warranted by the demands of justice. My concern is that these are being taken over by medicine and the corporal works of mercy are being reframed in these population terms. As Ivan Illich and Charles Taylor warn, the problem is that when we respond to the population, it may block our response to the person in front of us. Illich and Taylor identified one of the distinctive features of Christianity as its call to see the face of Christ in the other person, no matter what previous boundaries may have separated them from us, and then respond to it. This response is called forth by the suffering of the other whom we encounter and by our being viscerally moved by their suffering. The paradigm case they use is the Good Samaritan, as Taylor describes in A Secular Age. Quote, "Agape moves outward from the guts. The New Testament word for taking pity places the response in the bowels. We cease being able to make sense of this the more we go along with the alienating self-images that are required for modern institutions." And these self-images would be things like the mechanistic self-image of medicine, but also the population-based image of contemporary precision medicine. Illich and Taylor fear that this personal response is lost through the institutionalization of charity and solidarity. Quote, "The network of agape can only be created in enfleshment." End quote. Similarly, Pope Francis has called us to a culture of encounter, a personal engagement with the other, especially to the disadvantaged other. In Francis's thought, encounter stands in contrast to a manipulative, technocratic mindset. As he writes in Evangelii Gaudium, quote, the gospel tells us constantly to run the risk of a face-to-face encounter with others, with their physical presence, which challenges us, with their pain and their pleas, with their joy, which infects us in our close and continuous interaction. End quote. It is through these embodied encounters that we build the virtue of solidarity, which is a term that is frequently paired with encounter in Francis's writing. Francis, too, sees the parable of the Good Samaritan as a paradigm for Christian action. And historically, the documents like Salvifici Dolores and Samaritanus Bonus has made the Good Samaritan an important model for the Christian medical professional as well, a vision of medicine as a response to the individual patient. This model is best seen in Edmund Pellegrino's Medical Ethics, which describes the health practitioner stepping forward to respond to the suffering of the ill person and helping the patient seek their good as a person. Today, there's a danger that the institutional technocratic language of population stands in contrast to this encounter. To take another reinterpretation of a moral concept, precision medicine enthusiasts see the field as a way to reinforce social solidarity. According to Donna Dickinson, by caring for the population, precision medicine can become what she calls we medicine, as opposed to the me medicine of curative care or highly individualized prevention. Population health can turn towards the community and the common good, according to many bioethicists. However, by turning from the concrete other with whom one pursues a common end to the abstract population, these authors may betray the original meaning of solidarity and the common good. Now, solidarity is famously an amorphous concept, but the Catholic tradition describes it as a disposition or virtue, quote, a firm and persevering determination to commit oneself to the common good. It is a well-wishing for the other that arises from a shared purpose and a shared work. That's why it's so characteristically located in groups who engage in shared labor, such as unions or guilds. The common good that is aimed at is not a statistical description of the population, nor an aggregation of individual external goods like health, as one finds in the population vision. Instead, as Russell Hittinger describes, the common good includes shared purposes and forms of social relationship that arise from the joint pursuits of good. Solidarity describes modes of relationship, the concrete attachments that supports the participation of all in seeking a common end. This older ideal of solidarity as a bond with concrete persons or an actual community contrasts with solidarity oriented towards statistical measures found in precision medicine or population health. So I've so far presented two visions of medical care and the broader demands of Christian charity and solidarity, a care for populations and the individual only insofar as he instantiates a particular population versus the response to the other individual as a person. Now, don't misunderstand me. We, of course, need to respond to unjust social conditions. Dangers arise, however, when we do this in terms of at-risk populations, because the framework of populations is not just a parallel conceptual system to that of person, but can in fact sometimes run counter to it, undermining more personalistic encounter. Personhood is a relational concept pointing toward community, but it is different from the relationship holding between statistical data points. Statistical data refer to populations whose individual constituents are abstract and ideally equivalent in all but the metric considered. In contrast, politics and justice deal with a community of irreplaceable persons. Because of these different visions, the data-driven paradigm of population risks altering the meaning of medicine, solidarity, and the self. So this has been rather abstract to this point, but I'd like to turn to three examples that illustrate how a population framework can reshape our vision. So first, in a policy manner, it can redirect us from concrete cures to statistical prevention. It can cause an individual doctor to see the patient in front of her in terms of optimization and data. Finally, it can make the other appear as a danger. In all three cases, the real person is subordinated to statistical prediction. First, in public health and public policy discussions, the distinctions that I describe as between population and the person is reflected in a debate between saving statistical lives and saving identified lives. Frequently, it is a debate between prevention and cure. So a common used example of the problem involves a mine collapse and the decision whether to rescue the trapped miners. And the question is, why should we spend millions rescuing 33 trapped mine workers when the same amount would save many more lives if spent on safety improvements that prevent mine accidents in the future? The question comes down to whether to prioritize the lives of the individual mine workers who are currently trapped over all the possible future people who statistically could be saved by a preventive intervention. Where do our commitments lie? To saving those currently suffering, or to preventing the abstract possibility of future suffering? Economists, public policy analysts, and utilitarians have generally argued that there is no difference between statistical and identified lives. A life is a life in the equations. There's no reason for any preference between individuals. All that matters is maximizing the lives saved in the population. Any problems of future uncertainty, such as how do we know preventive measures will actually save lives, can in theory be factored into the equations. Note how this position reifies the possible and the counterfactual. It makes future possible harms equivalent to present disease. The possible dangers to future individuals in the population are made to exist in the real present of the decision. Those who embrace saving statistical lives are committed to denying the distinctions between present and future or actual versus possible. More importantly, this framework indulges in abstraction from the person that one confronts. A person with a disease or trapped in a mine must be seen as part of a population of many such deaths, abstracting from the concrete suffering that people now experience. So these are not merely abstract debates of analytical bioethics. They can have real implications. Emphasizing prevention over cure can serve as an excuse to focus on economic goods to the exclusion of the real suffering of the disadvantaged. Consider the example of the debate over prevention versus treatment of HIV. By the late 1990s, the advent of antiretroviral drugs such as AZT had made HIV into something more like a manageable chronic disease than the death sentence that it had been early in the epidemic. Yet the epidemic raged unchecked through the global south. Given the expense of antiretrovirals, global health agencies had chosen not to use them in low-income countries. Instead, they pursued a strategy of prevention, education, testing, condoms, and so forth. Many experts argued that prevention was a much more cost-effective population-level intervention than treatment, saving more lives per dollar spent. Global health agencies were also concerned about the capacity of local health systems to adequately distribute medications and whether there was sufficient health literacy to ensure compliance. So the identified lives of those dying from HIV were sacrificed to the statistical lives saved by prevention. Paul Farmer, an infectious disease doctor working in Haiti, along with many others, rejected this choice. He thought it was a moral imperative to treat those who can be saved by available medication, as he had an ironclad commitment to the concrete patient in front of him. Moreover, he found the economic analysis supporting exclusive efforts at prevention to be naive. If structural conditions like poverty or sexual violence are the root cause of HIV spread in the global south, then education will do no good in the face of ongoing structural violence. Further, no one would seek testing if there were no treatment, since a positive result would only lead to anxiety and stigma. The realistic, hard-nosed approach seemingly embodied in cost-effectiveness is in fact founded in an illusion, ultimately a cruel illusion. To confront claims that antiretrovirals could not be effectively used in resource-poor settings, the organization Farmer co-founded, Partners in Health, initiated a demonstration project in Haiti. They showed that HIV could be effectively controlled in the global south, given the resources. All that was lacking was the will to save suffering patients. This demonstration, along with Farmer's moral clarity, helped to push the international community toward HIV treatment in the early 2000s. Through initiatives like PEPFAR and the Global Fund, the world dramatically expanded antiretroviral treatment. Farmer showed the rationality and morality of treating identified over statistical lives. So the most commonly recognized objections to equating statistical and identifiable lives draw on the impossibility or at least the dreadful effects of performing this effort of abstraction on the individual who does the abstraction, and this is my second kind of concern. Objectors point to the empathy elicited by immediate suffering or to a psychologically driven rule of rescue that impels us to respond to emergencies. This is the personal response highlighted by Illich, Taylor, Francis, and Pellegrino. It would be harmful to medical care to have doctors who engage their suffering patients in an abstract way and instead of responding to their illness, judge them in terms of their cost in regard to population metrics. Pellegrino makes a similar argument that it is imperative that the doctor not be the one to make rationing decisions because that kind of prioritization of a social good over the patient would undermine the doctor-patient relationship. Moreover, as Marcel Verweij argues, rejecting the priority of identifiable lives might undermine communal solidarity because, as I noted earlier, solidarity is built upon practices of commitment toward concrete others. Solidarity depends on the belief that others will support you in suffering, even at cost to themselves. A focus on the statistical to the detriment of the actual can undermine the virtue of solidarity, so overly focusing on population-based prevention will not build solidarity. Even when medical practitioners engage actual patients, they can still do so under the form of a statistical vision. With electronic medical records, for example, doctors' vision is drawn to data even when the patient is directly in front of her. If AI-driven computerized decision support systems are integrated into electronic medical records, they will nudge the practitioner to judge the patient in population terms through the recommendations and the information they provide. Through them, institutions can encourage the doctor or nurse practitioner to view the patient only in terms of whether the prescribed medication reduces population risk. Given the short length of most appointment, practitioners have little chance to grasp the social and personal world of the patient. They only have time to see them in terms of physiological risk factors. Thus, patients can become statistical lives to the practitioner even when they sit directly in front of her. This changed vision of the patient can lead to great cruelty in the guise of care. I've previously written of high-risk patient programs where data analytic frameworks constantly force doctors to judge whether an individual patients are providing an adequate return on investment to the program, whether they're adequately reducing population-level risk in their own self. Those who aren't responding well enough are dropped from the programs. The reinterpretation of solidarity in terms of population risk can even make the other appear to be a threat because their actions or our interactions can raise risk. This is a theme of the literature on the Risk Society by sociologists like Nicholas Luhmann, Ulrich Beck, or François Eval. They argue that a lot of our thinking of population arose in response to epidemics, where others became risks, and also in the eugenics program. That's where a lot of statistical concepts arose in trying to figure out who in the population was a risk to kind of societal wealth. Most obviously, perhaps, seeing others as a danger became a predominant theme of our interactions during the COVID-19 pandemic. Of course, medical staff and other professionals provided direct care as part of their professional duties under difficult and frequently heroic circumstances. But for the non-professional, many of the most obvious paths of direct encounter were blocked. This had a grave effect on those who were institutionalized, whose opportunities for human encounter were severely curtailed. To slow the spread of the virus, nursing homes and hospitals were almost completely quarantined. Even visiting the sick for accompaniment or in order to offer the sacraments was disrupted. Older adults spent months in isolation. Alzheimer's patients and children with disabilities languished from lack of human contact. The dying were denied the comfort of loved ones and the spiritual solace of last rites. Residents' social worlds were eliminated, all in an effort to extend biological life, or rather to alter the statistical dynamics of disease spread. Paradoxically, the elderly and dying were socially isolated out of statistical solidarity. Unsurprisingly, anxiety and depression seem to have spiked. The example of pandemics further suggests the way that a population approach is not just an alternative model to older understandings of solidarity, but can sometimes actively undermine it. Other individuals become a threat. Even actions that don't directly concern us are threatening insofar as they shift the social conditions of risk. So perceived threats aren't restricted just to pandemic conditions, but extend to judgments about behavior that only impact the health of others. Take the disdain directed towards the obese. Beyond the class and cultural considerations at play, part of this outrage is based on population considerations of risk. They increase the risks of diabetes, heart disease, and other diseases, shifting the social distributions of risks. Ultimately, these risks translate into increased costs, which are distributed across society through the insurance system. becoming a burden on others. So by envisioning others as the source of danger, this framework undermines possibilities for communal action, solidarity, or a shared common good. Instead of engaging concrete others, what we are called to do is to care for the population as a whole by attending to the shifting probabilities of disease and mortalities that our actions affect. Under the regime of population risk, people still care, but that care is addressed to the statistical other, since the person will never know those whom his changed action, her social distancing, may affect. The concrete other, far from being a target of care, becomes a source of danger. The concrete other must be avoided. We stand together by standing apart. I want to reiterate, though, that the example of farmer shows that we need not compromise social justice and care for disease for care of particular patients. There are strong reasons for politics to address poverty, pollution, poor working conditions, all the concerns that are raised in many of these population health discussions. My concern is only with our way of seeing that precedes any intervention. The Catholic social tradition provides many resources for thinking through how to seek justice while respecting the person. For example, fighting poverty through demands for a just wage through solidaristic associations like the labor union. There is no need to turn to a technocratic vision of a population data to seek justice. To conclude, there is a broad social shift exemplified in movements like precision medicine and population health to understand the individual in terms of statistical data. This shift requires re-envisioning people in terms of risk and population, and thereby also reinterprets our moral concepts. The danger is that in our care for populations, we will lose sight of the person, seeing her only in terms of data. A data-based population approach is not just an alternative to a more personalistic approach, but it may be antithetical to it. Carter Snead warned us that medicine is losing embodiment in its focus on the autonomous will. But I am fearing we're losing both the body and the will to data. Real persons become absorbed by statistical lives and future dangers. Instead, persons must be understood as embodied, vulnerable, physical bodies, rather than the abstract nexus of population-based risks. Far from enhancing solidarity, the population perspective of precision medicine can serve to undermine community. In its wake, others become objects of fear or grossly statistical abstractions. Care for the immediately suffering is deferred to benefit future possible lives. That is not to say that addressing a suffering person does not have its own dangers. It can lead to burnout. Unwise and extreme efforts can be used, especially in end-of-life situations, and people can be reduced to simply the role of a suffering stranger. Still, engaging concrete others in their suffering opens the possibility of encountering a real person, providing aid, and seeing Christ in the other. Thank you.
So, thank you, Professor Scherz. That was excellent. Now we're going to take some questions for both of our speakers. So there is a microphone that'll be coming around, and I'll also be keeping a queue. So let's have our questions. The first question I see looks like it's over there. And I've got you second. You third.
Thanks, Paul and Jarrett. I enjoyed both your papers. Paul, I guess I'm going to just ask you a question. I think it's already the case in even those people who practice face-to-face medicine. When I was training in medicine, we were constantly pushed for evidence bases, right? And so right there at the very forefront of the thing that you're valorizing is still this sense of I've got to make a judgment about am I going to follow the fact that maybe 60% of people respond to this medication and 20% have an adverse reaction? And so I'm still already putting that into some sort of statistical frameworks. I think Foucault said something about that, like, Aristotle said, all knowledge is of the general. So it's sort of like, well, are we just stuck with this? And then it's sort of like, as an individual practicing physician, to try to keep the patient from falling into the statistical frame in whichever box we put them into, it's almost as if you have to follow intuition, which is something that no one likes people to follow, because you got to know if this one is the one that's going to be a responder or a non-responder or an adverse effect, and that's just a judgment call stepping into the breach. So it seems like medicine is still caught in that at the forefront of face-to-face medicine.
I would call that latter the intuition. I would call expertise, right? You know, I mean, hopefully over a long kind of clinic, you develop the clinical judgment to be able to do that. Yeah, so I think that's always going to be the case, but I think the practitioner is losing the power to do that. Once you get an AI decision-making system in there, they're going to just be told. As well as evidence-based medicine, you do need statistics, but I think that's slightly different from a lot of the precision medicine that I'm talking about, because in the use of statistics is to tell, does a medication work or an intervention work? Does this intervention work at all? It's not looking at the person in terms of their risks. So that's how I would differentiate those two.
Awesome. Our next question is right here.
Thank you for those really great presentations. I have a question that I think is more for Paul than Jarrett, but Jarrett may have something to say about it. So if we want to begin from the assumption, which I will in my question, that abortion is a moral violation, and that I don't want to argue about that, but I just want to say, let's start from there. And I've written a little bit about this problem, and that is that we have now in the obstetric environment so much information, data, about the embryo and the fetus, particularly the fetus, all of which is abstract information upon which a woman is offered various practices and treatments based on this information. This is how it works now. The moral difficulty is that the woman making, or the family making decisions about termination or continuation of a pregnancy is presented only with this statistical person. In other words, what we're talking about in terms of Levinas and the face of the other, what you mentioned about Paul Farmer, all of that, she never has the opportunity to meet the face of this child. But rather there is a statistical profile or risk profile put forward, and then decisions need to be made about that version of this person, who is a liminal person, of course, because the person is being developed, the person is also hidden from the human community. How can we think about ways to address the situation I'm describing as like a moral problem?
Yes, so I'm very much concerned with the increasing amount of statistical genetic data that's being given
Exactly.
to women. I mean, and this is just becoming more and more intense with pre-implantation genetic diagnosis, right? I mean, it's not just people are trying to diagnose a genetic disease anymore. It's like, what is this embryo's risk of heart disease, things like that. So, I mean, I think it's, yeah, no, I mean, this is another one of my major concerns about precision medicine. I write about this in a different part of my book. How do we deal with that? I have not done as much work with that, but Oliver O'Donovan and James Mumford, who is at this conference, have written books doing the phenomenology of how do you encounter this unborn child, right? And how do you have a phenomenological engagement? So I would recommend their work too.
Thank you. I believe our next question's over there, and then you.
Thanks, guys. A question for Jarrett, actually. Is